Welcome to How to Be a SimChart SuperUser. You are here to learn the ins and outs of the Simulation Learning System EHR, or Electronic Health Record, which is called SimChart. After completing this lecture, you will be designated as a SuperUser and will be a resource for your fellow students to troubleshoot the EHR during and after simulation. The primary faculty are always available for additional questions or new issues that may arise, but if you can help them through it, we'll expect you to do so. During orientation or during the first pre-briefing session, we will let the class know who their super users are, and your information will be posted on Blackboard. If there are any issues with this, or if after today you change your mind, please let us know. This is a new process and we do not want to stress out or isolate anyone. However, this is something you can put on your resume. Please follow along on your computer as we take you through the steps of logging in, navigating, and using your SimChart or Simulation EHR. If anyone needs a break or has a question during the presentation, please let us know and we will work through this together. If you are following along with this presentation after the live presentation, please pause the screen if you need a moment and email me if you have any questions. Please ensure you have a working Evolve username and password. To create or access the Evolve website, go to the website posted. To obtain access or troubleshoot issues with access, please contact Dr. Sarasnik or Professor Barkerstock. You can also reach out to me and I will pass the information on to someone who can fix it. First, we'll start with how to access the patient's chart. Again, this is also called the EHR, Electronic Health Record, or SimChart in the SLS system. Please do these steps as I read through them. Enter the SLS system by clicking Simulation Learning System. You'll then choose your patient scenario by clicking Simulation Scenarios. For this example, please choose Respiratory, and it's scenario number 3, Kimberly D. To access the EHR, choose Scenario 3 Documentation. In parentheses, you will see EHR. Now click to access simulation. Was everyone able to get through these steps? Are there any questions before we continue? Please pause if you need extra time or email me if you have any questions. Upon entering the chart, a simulation information box will appear. What you will find on this screen are patient demographics, background of illness, start pre-simulation, start simulation, print phase info, and simulation history. If you are accessing the chart prior to the simulation day, you should choose the Start Pre-Simulation button. If you are accessing the chart to document during simulation or after simulation, you will choose Start Simulation. Please note that you cannot save documentation when you are under pre-simulation. The Print Phase Info button will print what is currently on the screen, or the Simulation History button will give you a little additional information on the patient. For this example, please choose Start Simulation. After choosing Start Simulation, a box will appear to confirm you wish to begin. Choose OK, and this box will appear, still entitled Simulation Information. Buttons on this page include a Previous and Next button, which will take you between phases if the scenario has more than one. Please note that most of our simulations only have one. You still have the option of choosing Print Phase Info and Simulation History on this page. The other buttons are Continue with Phase 1 and Complete and Submit. This is very important, and you should emphasize this to your peers that you're working with. The Complete and Submit button should only be pressed when you are 100% done with your charting. After you hit this button, changes cannot be made in the chart. However, this is the button you must click to have your charting graded. For this example, please choose Continue with Phase 1. Welcome to the EHR. You will always enter here into the summary screen. Here you'll find the patient fall risk, pressure sore risk, sleep apnea risk, their code status, allergies, isolation and alerts, their medical history, diagnoses, their patient monitoring, including vital signs, blood glucose, pain, and I's and O's. You'll see IV lines and active wounds. And if you scroll down below IV lines, you'll see tubes and drains. And this is where you'll find things like chest tubes, catheters, etc. On the left-hand side, you'll see the info panel, which includes things like provider charts, patient charting, order entry, results, vital signs, your MAR, patient teaching, your care plan. We will go through some of these in more detail later. Some will be used more than others, and a few you may never use at all. Lastly, at the top, you'll find demographic info, height and weight, allergies, isolation, diet, BMI, and the hospital floor. To return to the previous screen where you saw the buttons for Continue Phase 1 and Complete and Submit, you'll choose Simulation Information. Please remember that this is how you will go to complete your charting, and you do not want to hit Complete and Submit until you are 100% done. The last thing I want to point out on this screen is the red letters which say phase time exceeded, or yours may just say phase time. The EHR is set with a time limit for completing the documentation, but on the back end, we have shut off this time limit. We want to remind students that there is no penalty for exceeding the time frame, and that you can simply continue in the phase you're currently in, or continue to the next phase and finish your documentation. Basically, ignore this warning if you see it. What we will do now is just review the parts of the chart from the top to the bottom, emphasizing those that will be primarily used in our simulations. Before we do that, are there any questions? Under Provider Charts, you will see Provider Orders, History and Physical, Progress Notes, and Consultation Reports. To enter these parts of the chart, you must actually click on the words. So for example, click on the words Provider Orders to see Provider Orders. Please do so on each of the tabs so you can see what they look like. Under Provider Orders and Progress Notes, new entries can be made by entering the information, entering your name as the signature, and clicking the plus sign under Action. Let's do this for practice. Choose Progress Notes. Enter a note under the words Progress Notes. For example, patient is alert, awake, and oriented ×4. Vital signs stable, denies pain, discharge teaching complete, plan to discharge this afternoon. Sign by entering your name under signature, and then click the plus sign under Action to save your work. You will see my saved work has moved down. A few things to notice. The day and time correspond with the day and time of the structured scenario, and not necessarily today's day and time. This is fine and does not need to be changed, and we just want students to be made aware of it so it's not confusing. Also, under Action, you can delete and edit your documentation, but only your documentation. Next, we will look at patient charting. Again, to access the different sections under patient charting, you will need to click on that section. For example, system assessments, which is shown on the screen. Please take a minute to click through each section under patient charting to see what is available. The most commonly used sections will be system assessments, IVs, tubes and drains, and special charts. First, we will look more closely at system assessments and then move on to IVs, drains and tubes, and special charts. There are two main ways to document the assessment. The first is to choose Complete Physical Assessment head to toe. This will expand to provide students with a freehand option to document each body system. As you scroll down, you will see all of the body systems ending with Other, Assessment Findings, and Plan. Only the body systems which were assessed should be documented on, and there is a Save button at the bottom of the screen to push when complete. The second option to chart your assessment is to choose each body system and then click and choose your findings. This is going to be a little bit more like what you will see in the hospital. This will include all of the sections from cardiovascular assessment down. Personally, I find this method as ideal. It allows students to choose their findings. It alerts them to assessments they may have missed, and they can go back and do so if they're live in the simulation, or they can log that information away to use next time. Under each section, there is a comment section for miscellaneous information or more clarification. Let's take a closer look at one section to get comfortable with this. If you would like to take a minute to look through other sections when we are done, please do so. For this example, choose Neurological Assessment. As you open Neurological Assessment, you will see your basic neuro assessment pieces, like level of consciousness, orientation, hand grips, and foot pumps. As you scroll down, you will notice more specific neuro findings, like headaches, syncope, and seizures under the central nervous system, extrapyramidal side effects, and disease or condition-specific symptoms. Notice some sections have a scroll bar, indicating there are more options to choose from further down the list. At the bottom of the screen, notice there are links for additional charting. I recommend clicking on each of these as they will open and remain open under the charting that is already being completed. The student can then continue to click and choose what has been assessed, leaving blank what they did not. Click on Neurological Checks at the bottom to view it. Under Neurological Checks, you'll find pupil reaction and size, limb movement, and coma status. If you also clicked Neurological Interventions, which was to the right of Neurological Checks, you can continue to scroll down and see the neurological care provided, seizure precautions, and patient response. Again, this is a click and choose option, and all sections will have a notes section for more detail. Remember these scrolling bars for more options under each section. Students can choose to either open and document under each body system and then save, or save between each body system. But don't forget to click the Save button at the bottom of the screen. A few notes about saving your work. The sections that are unsaved will be marked in red and marked unsaved in parentheses. After clicking Save, the section will collapse and documentation will disappear. But you can view your saved documentation by clicking Show Saved Charting. As we go through the different slides, you should always see a way to review your saved charting, but it may be worded differently. I will point this out as we go along. For practice, please document what is on the screen under Neurological Assessment and save. While you are documenting, please pause the presentation and resume it when you are ready. After clicking Save, a confirmation will appear in the right upper corner. Remember that there should always be a way to view your saved charting, in this case by clicking the words Show Saved Charting. After you click this, you will now see the saved charting. You will see the date and time. Again, this is set by the scenario and not the real date and time. You will also see the entering user and what was entered. To see the details, click on the hyperlink circled and view. Do this now to review your saved charting. In most scenarios, you will be asked to document the IV site. The IV section is found under Patient Charting about 3/4 of the way down. When you click on this, an image of a male or female patient will appear. To document your IV site, choose the placement of the IV. For example, right antecubital or right AC. Choose this on our patient now. Notice our new IV will be marked with a yellow box. You may also see a red box indicating active IV or green box indicating a discontinued IV. Because the IV site for your simulation patient may differ from what is in the EHR, I recommend creating a new IV for your documentation. After choosing your IV site, the EHR will present a click and choose way to document. Choose peripheral under type of IV access, and more options will appear under skin assessment, dressing care, patency, and patient response. Remember to document only things that were assessed, done, or applicable to this patient. For practice, document that the IV showed no redness or swelling, the dressing was clean and dry, and the IV was patent and flushing easily. The patient had no complaints. As always, the Save button is at the bottom of the screen. After you have saved, you'll notice that the IV is now red, indicating that it is an active IV. Next, we will practice documenting in the MAR. To document patient medications, choose MAR under the Info panel and then MAR again right underneath that. Notice the patient's medications are separated by status. There are stat meds, scheduled meds, IV fluids, and PRN meds. Across from the medication name, you will see the order start and stop dates and times, the dose, route, and dosage time. To document a medication was given, use the action buttons on the far right side. A green button indicates it is appropriate to give this medication to the patient at this time. For this example, choose the top albuterol nebulizer and click the green button to administer. A new box will appear. Because we do not use the barcode scanner at the Rise Center Hospital, choose Proceed without barcode scanner. You will then be prompted to enter the administered time, comments, your initials, and save. If the medication was not listed in the MAR, it may be a new order given by the physician or nurse practitioner during the scenario. You will have to enter this order first and then complete these steps to document the administration. We will practice entering orders next. To add an order in the EHR, please choose Order Entry and then the type of order you will enter. For practice, we are going to first order the patient Lasix 20 milligrams PO BID and then a STAT 2-view chest X-ray. For a medication order, choose Pharmacy. Type in the medication name and choose the appropriate order. For example, Lasix gives the option for IV Lasix, an oral solution Lasix, and tablet Lasix. It's also listed under its generic name, furosemide. Choose furosemide tablet in parentheses Lasix. Then choose the order type, start date and time, route, dose, frequency, and click Add Order in the center of the screen. For the start date, you may choose the day and time of the actual scenario or day of the scenario and midnight, and you will find this at the top of your screen. Once you hit Add Order, it will move down under All Order Summary. To complete the order, you must then hit Submit Order. But please note that if you are adding multiple pharmacy orders, you may add them all to All Order Summary first, and then just choose Submit Order once. Next, we will add our order for the chest x-ray. For all orders that are not medications or labs, choose Diagnostic Test. First, we will choose the category based on the test. The chest x-ray will be found under X-ray examinations. Things like a 12-lead EKG would be found under electrodiagnostic tests. After choosing this category, choose the diagnostic order type. If you start to type in what you want, for example, chest for chest x-ray, you should see options to choose from. Because we want a 2-view chest x-ray, we will choose the posterior, anterior, and lateral views option at the bottom. Now choose the order priority, transportation, and whether an IV or O2 is required. If the order is now or stat, no order date is required. If this is a routine or timed order, a start date must be selected. This also applies to the medications. Choose Add Order to move it to All Order Summary. And when you've added all the orders under Diagnostics Tests, you can hit Submit Order to finalize it, just like we did with the medication example. The last part of the chart we want to explore is the S-bar. The S-bar charting can be found under Patient Charting and Special Charts. When the S-bar report shows up, you will simply freehand type the situation, background, assessment, and recommendations, and choose Submit S-bar report at the bottom of the screen. The recommendations should be the recommendations you gave during the scenario and not the orders given by the provider. Once all your charting is complete, it is finally time to complete and submit the chart for grading. To do so, you will choose Simulation Information in the upper right-hand corner. This should be accessible from any screen within the EHR. Then choose Complete and Submit. A confirmation will appear. Choose OK. A final confirmation will appear, letting you know that your assignment has been submitted for grading. You will receive an email letting you know the EHR has been reviewed. Grading will be listed as either complete or incomplete. The reviewer will provide positive feedback on your charting and detail areas for needs for improvement. This feedback is to be used to improve on future documentation and simulation, in clinical, and when you leave Robert Morris. Please note and remind your peers that the EHR is part of your post-simulation work. It will be clear when it is to be assigned based on your Blackboard postings and discussion during simulation. If there are any questions about this training or any questions that your peers ask and you cannot answer, please reach out to myself, Professor Barber, or Professor Bargerstock for help. Thank you so much for being a super part of the EHR SuperUser team.